When we think about motherhood, there's this picture-perfect image that comes to mind, right? Glowing, happy, just blissful. But for so many women, that's not the reality, not even close. Today, we're going to pull back that curtain and talk about the unspoken side of it all, perinatal mood and anxiety disorders, or PMADS. This is the hidden struggle that so many new mothers are facing. So let's start with the pressure, because it is immense. There's this quiet, but really powerful expectation that being a new mom should just feel natural and joyful right from the get-go. But what happens when it doesn't? And this quote right here, it just gets to the absolute heart of the problem. It's that word, should. That feeling that you should be happy, you should be grateful. It creates this heavy stigma that makes it almost impossible to say, hey, I'm not okay, because you feel like you're failing. There's actually a name for this, and I think it's just brilliant. It's called duck syndrome. Think about a duck on a pond, right? On the surface, it's all calm and graceful, but underneath the water, its little legs are paddling like crazy just to keep from sinking. That is what so many mothers are doing, projecting perfection while they are struggling so hard just to stay afloat. Now, a lot of this pressure is built on a really common and frankly a very dangerous myth. I'm sure you've heard it before, this idea that all those pregnancy hormones somehow create a magical shield against mental health issues. So let's just tackle that head on. The answer is a huge, emphatic no. Let's just be crystal clear on this one. Pregnancy is not a protective bubble. It doesn't magically prevent mood or anxiety symptoms. And believing that it does, well, that just makes mothers who are struggling feel even more alone. And because of all this, the stigma, the myths, what we're left with is basically a hidden epidemic. You might be wondering just how widespread this really is. Well, the numbers, they're pretty staggering. Get this, roughly half of all women who have depression during pregnancy or after giving birth are never even diagnosed. Think about that. They are completely invisible to the healthcare system, suffering in total silence. But okay, what about the ones who are diagnosed? Surely it gets better for them, right? Well, not really. Over 90% of women with perinatal depression don't get adequate treatment. So they might get a diagnosis, but they're not getting the real, sustained help they actually need. So when you put those two groups together, the ones who are never diagnosed and the ones who are undertreated, you get this shocking number. Up to 85% of women with these conditions get no treatment at all. It's a massive, gaping hole in our system of care. And this isn't just a personal tragedy for these families, it's a huge societal issue. In the US alone, the cost of untreated PMADs is about $14 billion every single year. That's from lost income, extra healthcare costs. The price of the silence is just immense. So if this problem is so big, why is getting treatment so tricky? Well, for the women who do manage to seek help, they often find themselves at a really difficult crossroads, staring down a set of choices that can feel really scary, especially when it comes to medication. And this chart really lays out the dilemma. On one hand, leaving the illness untreated has serious risks for both mom and baby. We're talking toxic stress, developmental issues. But on the other hand, any treatment, like medication, comes with its own potential risks of exposure for the baby. It's a terrifying balancing act, and there are no easy answers. So, faced with that kind of impossible feeling choice, how on earth do you decide what to do? How can a mom who's already feeling completely overwhelmed make that call? Well, the answer isn't some magic bullet. It's a conversation. It's about shared, informed decision-making between a woman and her doctor. It's about sitting down and openly talking through the risks and the benefits for her specific situation, for her baby. There's no one-size-fits-all solution here. And here's the really good news. Once that conversation starts, there's this incredible modern toolkit of effective treatments that opens up. This is not a hopeless situation by any means. So let's take a look inside that toolkit. First, we have to talk about something that is so common but so misunderstood and scary: intrusive thoughts. These are unwanted, often terrifying thoughts or mental pictures of something bad happening to the baby. I want to be really clear, these are not desires. They're a symptom, like a cough is a symptom of a cold. They're a classic sign of perinatal anxiety or OCD. This quote from a patient's story is just so powerful, isn't it? It perfectly captures the shame and the fear. Women think they're going crazy, that they're a monster.
But the most important first step toward healing is understanding that this is a symptom of an illness, not a reflection of who you are as a mother. And the toolkit for dealing with this is actually pretty robust. Psychotherapy is a huge one, things like CBT, which helps you change those negative thought patterns, or IPT, which focuses on your relationships. Of course, there's medication. SSRIs are a mainstay, and for many of them, we have a lot of reassuring safety data. And then there are things like integrated care, where your psychiatric and obstetric care happen in the same place. For really severe cases, even ECT can be a safe and incredibly effective option. The point is, there are so many paths to feeling better.
Now, a really critical part of this modern approach is something called trauma-informed care. These 4 Rs are basically a guide for providers. It starts with realizing how common trauma is, then recognizing the signs. Next, responding by actually using that knowledge in how they treat patients. And finally, and maybe most importantly, resisting anything that could accidentally re-traumatize someone. It's all about creating a safe space for healing.
Okay, so what's the big takeaway from all of this? Why does this matter for you, whether you're a parent, a partner, a friend, or a family member? Well, it really comes down to having practical tools and understanding the simple power of connection.
And one of the most practical tools out there is a collaborative safety plan. This isn't some scary contract, it's a roadmap. It helps someone figure out their personal warning signs, what they can do to cope on their own, and who they can call when they need help. It's a concrete plan for a crisis. And a really key part of it is reducing access to lethal means, a simple step that truly saves lives.
Which brings us all the way back to the beginning, back to that duck paddling like mad under the water. The single most powerful thing any of us can do is to stop accepting the calm surface as the whole story. We have to be the ones to dive below the surface and ask, how are you really doing? And then be ready to actually hear the answer. So I'll leave you with this final thought. We've talked about the science, the stats, the treatments, but what if at the end of the day, the most powerful first step, the most effective medicine we have, is just breaking the silence? What if that's where healing actually begins?